Hi everyone. Today I want to talk about something most men over 60 do, but almost no one talks about it out loud. I'm talking about masturbation. And before you scroll away, hear me out. This isn't a joke or a taboo topic. As a urologist, I've seen how solo activity can actually support men's health, but I've also seen what can go wrong when it's done the wrong way, especially as we age. Your body changes, your hormones shift, and what felt normal at 30 might feel completely different at 60. In this video, I'll walk you through what really happens to your body after 60, how to stay safe and comfortable when you do it, and the signs that mean it's time to check in with your doctor. So, let's start by understanding what's actually happening inside your body as you age, because knowledge is the most powerful tool you have. When you reach your 60s, your body doesn't stop working, it simply changes. And understanding those changes is the key to staying healthy, sexually and emotionally. Many men are surprised to learn that what they experience is completely normal. First, let's talk about hormones. Testosterone, the hormone that influences sex drive, muscle strength, and energy, naturally decreases with age. Research shows that levels can drop by about 1% per year after your 40s. That doesn't mean your desire disappears. It just means it may take longer to feel aroused or to maintain the same level of intensity you once had. It's your body adjusting, not failing. Next, there's blood flow. As we age, arteries stiffen slightly and circulation slows down. That means erections might take more time to appear and may not feel as firm as before. It's not just about the genitals, it's about overall cardiovascular health. Keeping your heart and blood vessels healthy through gentle exercise and diet supports sexual function too. Now, the prostate, that small gland that tends to get bigger with age. An enlarged prostate, or benign prostatic hyperplasia, can press on the urethra and change how you ejaculate. Some men notice less fluid or a different sensation when they climax. It's usually harmless but worth monitoring, especially if you experience discomfort or urinary changes. You might also notice that your skin becomes more sensitive or drier. That's a natural part of aging, and it can make friction feel different during solo activity. Simple adjustments like using a water-based lubricant can make a big difference in comfort and safety. The bottom line is this: your body isn't breaking down, it's evolving. These changes are signals, not warnings. When you understand what's happening, you can work with your body, not against it. Up next, we'll talk about what really matters, how to masturbate safely after 60, and how a few small adjustments can make it both comfortable and beneficial for your health. Now that you understand how your body changes with age, let's talk about something equally important: how to enjoy masturbation safely after 60. This isn't about restriction. It's about understanding your body's new rhythm and responding to it with care and awareness. First, take your time. Many men are used to quick, goal-driven habits, but as blood flow slows with age, your body might need more time to become fully aroused. Think of it as warming up your muscles before a walk. It improves circulation and helps prevent discomfort. Slow, steady stimulation allows your body to respond naturally and can even make the experience more satisfying. Second, use lubrication. Skin tends to become thinner and drier with age, which means friction can cause irritation. A water-based lubricant is gentle, safe with most toys, and easy to clean. It's a simple change that makes a huge difference in comfort and safety. Third, be mindful of your grip. Over time, using a very tight grip can desensitize nerves and make it harder to respond to natural sensations or a partner later. Try varying pressure or using your non-dominant hand occasionally. This helps retrain your body to be more responsive and sensitive. Fourth, watch your posture and breathing. Sitting for long periods or tightening your pelvic muscles too much can cause strain or lightheadedness, especially if you have blood pressure issues. Stay relaxed, breathe normally, and listen to your body. And finally, be aware of your medications. Certain prescriptions for blood pressure, prostate, or depression can affect sensitivity or orgasm. This is completely normal and something you can discuss with your doctor if it becomes bothersome. Remember, this isn't about doing it less. It's about doing it smarter, in a way that supports your body's needs and keeps you safe. In the next part, we'll talk about an often overlooked topic: when it's time to see a doctor, and the warning signs you should never ignore, even if they seem small. Even when everything seems fine, there are moments when your body might be trying to tell you something. Masturbation, like any other physical activity, can reveal early signs of health changes, and recognizing them early can make a big difference. Let's start with the most common red flags. If you ever notice pain during or after masturbation, that's a signal worth paying attention to. It could be related to irritation, prostate inflammation, or even a urinary tract issue. Occasional mild discomfort isn't unusual, but if it happens repeatedly or becomes stronger, it's time to bring it up with your doctor. Another important one: blood in semen or urine. This doesn't automatically mean something serious, but it shouldn't be ignored either. It can result from minor inflammation, enlarged prostate, or other underlying conditions that a urologist can easily check through non-invasive tests. Also, if you experience a sudden change in sensitivity, such as feeling completely numb or unable to reach orgasm despite arousal, that could indicate a nerve issue, medication side effect, or circulation problem. These are all things your doctor can assess and help manage. Persistent pelvic pain or pressure, especially around the lower abdomen or testicles, is another sign to take seriously. Sometimes it's linked to prostate enlargement or pelvic floor tension, both treatable conditions when caught early. And finally, if you notice urinary changes like weak flow, frequent nighttime trips, or difficulty starting, it could be connected to prostate health. These are among the most common reasons men over 60 visit a urologist, and most of the time, the solutions are straightforward. Seeing a doctor isn't about something being wrong. It's about staying informed, taking charge of your health, and making sure your body continues to function the way it should. Up next, we'll wrap everything up with some final thoughts on how to embrace your sexual health confidently, because age doesn't define pleasure, understanding does. Getting older doesn't mean losing your sexuality, it means learning how to understand your body in a new way. Masturbation after 60 isn't something to be embarrassed about. It's a part of maintaining physical comfort, emotional balance, and even prostate health. What matters most is how you approach it, safely, mindfully, and with awareness of your body's signals. If there's one takeaway from this video, it's this: your sexual health is a vital part of your overall well-being. Talk openly with your doctor if something feels different, stay informed, and treat your body with patience and care. Age brings wisdom, and that includes understanding how to stay connected to yourself in a healthy way. If this video helped you see your health from a new perspective, hit the like button, share it with someone who might need to hear this, and subscribe for more honest, science-based discussions about men's health. And remember, pleasure and health can go hand in hand at any age. Next time, we'll dive into simple daily habits that support better blood flow and improve sexual wellness naturally. So stay tuned.